Hi, everyone. Welcome in. We're just going to wait for a few minutes and wait for everyone to join. Hi, everyone. Thank you for joining. We're gonna give it a few minutes until we get started. Thank you for everyone for hopping on. We'll probably give it about 2 more minutes or so um, as people keep joining. Thank you, everyone, for joining. We'll probably give it about 1 more minute, then we'll get started. All right, we're going to go ahead and get started for the sake of time. Welcome. Thank you, everybody, for joining us today. We will be hearing from Dr. Sandra Vanegas and Adra Mersinger. I'm going to read some quick backgrounds for each of our speakers today. Dr. Sandra Vanegas is a research associate professor at the School of Social Work and director of research at the Texas Center for Disability Studies at the University of Texas at Austin. She also serves as the clinical training director for the Autism Consortium of Texas LEND program. Her interdisciplinary work focuses on culturally informed research and interventions for neurodevelopmental disorders. She earned her PhD in developmental psychology with a minor in statistics from Loyola University Chicago, where she investigated cognitive processing styles in children with autism. She holds an MS in Human Development and Early Childhood Disorders from the University of Texas at Dallas and a dual BA degrees in Psychology and Comparative Literature from the University of Rochester. Her research portfolio includes numerous federally funded research projects addressing disparities in autism diagnosis, healthcare transition readiness, and culturally tailored interventions for underserved populations. We also have with us Adra Mersinger. Adra is the project coordinator for the Texas Autism and Developmental Disabilities Monitoring Network, or Texas ADDM, at the Texas Center for Disability Studies at the University of Texas at Austin. She started her time on the Texas ADDM project as a lead data abstractor in April 2023 and then transitioned into the project coordinator position in the fall of 2024. Adra's professional focus is autism spectrum disorder and other developmental disabilities in children. Her experiences bring perspectives from ABA therapy and various administrative healthcare services. She is currently a graduate student and working towards her Master of Public Health at the University of Michigan School of Public Health. And Adra holds a Bachelor of Science in Psychology from Texas A&M University. All right, and just to let everybody know, feel free to use the chat function, but there will also be time for questions at the end. And then lastly, before I pass it over, I just want to let everybody know that at the end of the webinar, you will be redirected automatically to a survey to complete. And if you requested a CEU for this webinar, you'll be redirected after that. All right, now I'll hand it over to Sandra and Adra to get started. Thank you guys for being here.
Okay, thanks for inviting us. We're excited to share some of our data, our most recent data from our work with ADDM. So we'll be talking about some of the outcomes from the CDC ADDM network, as well as from the Texas ADDM site that we are a part of. And just to go over some objectives, we'll describe the latest national autism data. We'll summarize some of our findings from our more local site. We'll kind of talk a little bit about how we can use some of this ADDM data to inform our current practices. And then we'll share some resources with you all about what we're doing to try to increase access to screening and other resources for families. And I'll pass it over now to Adra, who will give us some of that background on CDC ADDM. Go ahead.
Hello, everyone. My name is Adra. And so we're going to start off with the basics of ADDM. So what is ADDM? ADDM stands for Autism and Developmental Disabilities Network. This was started by the Centers for Disease Control and Prevention, CDC, in the year 2000, which is now 25 years ago. Their main goals include describing the population. So what is this population? It is children with autism and other developmental disabilities. And how do we describe them? Well, we are wanting to understand their different characteristics of the children who are identified with autism. And these characteristics include sex, race, ethnicity, household income, and geographical location. We compare data across different sites. How is autism identified at these sources, and what does that look like? Measuring progress in early identification, we measure how well our efforts are in identifying young children. We look at how accurately and efficiently these children are screened and evaluated. And this ties in with identifying changes in the autism prevalence over time. How well are our efforts and processes working to strengthen early identification within our communities? And understanding the impact of autism in US communities, how are families getting connected to resources for their children? how many people do and do not have access. Okay, next slide, please. All right, now we're going to discuss prevalence. Prevalence is a percent or ratio. Now, when looking at this image here, we have people who are colored yellow and people who are colored red. And in terms of the ADDM project, how many children in the country are like this? Of all the children in the country, how many are like this? So, of all the children in this community in the image, how many of them are found to be an autism case? And so to calculate this, we would divide the number of identified cases by the total population. So here there are 6 people who are identified to have had autism, the red people. And then there are a total of 33. That gives us an 18% prevalence of autism in this specific community with a ratio of 1 and to 5.5. Next slide, please. What are the methods that the ADDM network utilizes to estimate the number of children with autism? Ultimately, how do we determine if a child has autism? We complete a systematic review of records, and these records are across various health and education sources. Next slide, please. How do we determine if a child has autism? We do this by completing the systematic record of review of records. We are looking for a written autism diagnosis by a qualified professional, for example, a pediatrician, psychologist, psychiatrist. I have a very specific example of what this written autism diagnosis might look like. And it may state something like, according to all evaluation, test, and caregiver information, child does qualify for autism services, and that may be seen at the school level. And then an alternative statement would state that child does present as someone with autism spectrum disorder, and that can be seen more so in health sources. A child may also receive a special education classification of autism, and that is at schools. Or the child has an autism ICD code, and this is obtained from administrative or billing information. Next slide, please. Oh. And now I will pass it over to Dr. Vanegas.
Okay. So now we kind of covered the basics of the ADDM network and how it collects data. We'll take just a deep dive into some of the newest data released from the CDC. A lot of this data was released back in April, but I think there's still a lot of opportunities to learn about what this data tells us about cases of autism. So first, we just have a map just so you have an idea of where all of the data came from that contributed to the newest prevalence numbers of autism. So as you see, there's a lot of discussion about being the national prevalence numbers, right? But if you look at the map, it really doesn't reflect every single state in the country, or even like entire states, for example. So essentially, CDC ADDM contracts out with different sites across different states to do this level of work. And what you'll see in the green is where those specific sites are located or where the data collection was taking place. And then in gray is just reflects the states that are being represented in the national numbers. So there is a lot more representation this year than in previous years, and I'll highlight a little bit about that later on. And then in this year, we also have Puerto Rico as part of the network, so they have also contributed data to the new prevalence numbers. All right, so the way that the process works for autism surveillance efforts is that we look at 4-year-olds and 8-year-olds. We'll start off with 8-year-olds because I think at this point we know the child has entered school and we have a pretty good sense of whether or not a child may have some early differences. And it gives us a good parameter of whether or not we're identifying children in a timely manner. So this is some data that you've probably have already seen before, but overall, looking at data collected from all of those sites, we found that about 1 in 31 children among 8-year-olds has been identified as having autism, and this translates to about 3.2%. And one of the things that I think CDC and all of our work has really tried to highlight is that this isn't something that is consistent across the board. As you can see on the graph on the right, the prevalence numbers varies quite a bit across different sites. So at the bottom on the x-axis of the graph, you'll see all the different sites listed. And you'll see some sites that are identifying quite a bit of number of kids, such as Pennsylvania and California. But then you'll also see some other sites on the other end where their prevalence numbers are a bit lower. And there's a lot of reasons for some of these differences, right? And we can think about what is available locally to support the early identification of autism. But as you can see, there's quite a bit of variability of autism prevalence across different sites. One of the other things we look at is the distribution of autism across racial ethnic groups. We know there isn't any genetic differences in terms of how or why autism would manifest in different populations. But I think it helps us understand whether certain groups have better access or not to services. So this is for the overall site, all of the 16 sites, and looking at the racial ethnic differences. Some of the newer findings are that some children are more likely to be identified, for example, than white children. Something to note, for example, for American Indian or Alaska Native children, there is quite a bit of variability across the sites in terms of that prevalence number. So that just highlights just the vast differences that we see across different states in terms of access to services. Next, we highlight a few things. So here we look at intelligence quotient, which we use to look at whether a person has an intellectual disability or not. And this also helps us know who are the children that are being identified, right? Is it the children who have more substantial needs, or are we pretty consistent across all types of needs in identifying children with autism? So on the far left, we see the distribution by sex. So we do see that the distribution across IQ levels is pretty similar across males and females. So we are doing pretty balanced work there in terms of identifying children across, there's no sex difference essentially. Something to note though, when you look at racial ethnic differences, is that there are some differences in terms of higher rates of identification of children with lower IQ among certain racial ethnic minority groups. So for example, of all the Black children who were in our analyses, a substantial number had IQs lower than 70. And this was significantly different than children who were white or with 2 or more races. And then some other groups that were significantly different were also, I think, Asian Pacific Islanders and Hispanic children. There was a higher rates of lower IQ among those children captured than when compared to white children. So this gives us a sense that within these groups, we may be not identifying as many kids who are perhaps in that middle range, right, between 71 to 85, and that our efforts are really finding the children who have maybe more substantial needs. Next, we have some other data that we look at is the distribution or identification of autism across children who live or reside in a household and by income. So this is really looking at regional differences in terms of median household income. Overall, they found that there was no significant differences in terms of children who lived in higher income households or regions versus lower income. So it's pretty similar when you look at the data nationally. Next, in this slide, this kind of shows us some longitudinal data. So Adra had mentioned previously about how one of the goals of ADDM is to look at trends over time to see how prevalence changes. And this is kind of what this map intends to do. So we have the prevalence bars here from the year 2000 all the way to the year 2022, which is the data that we're presenting on today. And one of the things I wanted to highlight too, and you'll see the numbers in white at the bottom, these reflect the number of sites that contributed data, autism data, to those prevalence numbers. As you can see, it has fluctuated quite a bit over time and hasn't really fully captured all 50 states, right? So it is something that it is a limitation of some of this data in that we are using data from a select number of sites to extrapolate or to extend those findings to a much larger group. But overall, we do see that there has been an increase of autism over the years. A lot of this can be tied to some of the efforts from CDC ADDM in terms of increasing awareness. And we'll talk about a little bit more about some of these efforts later on. But we do see that shift in over time in cases of autism. Let's see. Okay. So now we're going to shift gears a little bit to talk about 4-year-olds. The inclusion of 4-year-olds is a much more recent component to the CDC ADDM network efforts, with the idea that by looking at 4-year-olds, we can really look at how early are we actually identifying these children, and are we doing really well in terms of identifying them earlier in time so that they can start getting services, either an early intervention or an early childhood special education. So in terms of overall prevalence, we do see similar numbers as the numbers for 8-year-olds. So overall, about 2.9% of 4-year-olds were identified as having autism, or 1 in 34. And then as we saw with 8-year-olds, we see some similar differences as well in terms of that variability across sites, where some sites are doing really well, such as Puerto Rico and California, in terms of that early identification, whereas some other sites have a much lower prevalence or lower identification of autism cases in their areas. Let's see. We can also look at some of those racial ethnic comparisons. And this is also looking at data from all 16 sites. So we do see that there are some differences across racial ethnic groups. And actually we see a higher prevalence among Hispanic children being identified as a 4x4 than some of these other groups. And kind of similarly for American Indian and Alaska Natives, we do see that very broad range of variability in terms of identification across the different sites. Let's see. So one of the other things we can do by having data from 4-year-olds and 8-year-olds is that we can kind of see whether our efforts are improving over time. If the prevalence numbers are pretty similar, it suggests that our efforts are pretty consistent in terms of identifying children. And one of the things to note here, so this on the bottom axis, you'll see all the different sites. And then you'll see in yellow is the prevalence ratios for 4-year-olds, and then in blue is the prevalence ratios for 8-year-olds. So when there is a big difference, that means that our efforts are different for those two age groups. So these were all children who were either 4 or 8 years of age in the year 2022, just as a reference. So some of the things that stand out, for example, is Puerto Rico, where their prevalence of 4-year-olds is a lot higher than 8-year-olds, for example. So this suggests that there might have been some shifts in that early identification efforts that Puerto Rico engaged in to identify or to increase awareness of autism screening, to identify children in their community. And and I think that's the most standout one. But we do see some differences. For example, with Arizona, there's some difference where there's a higher prevalence among 8-year-olds and 4-year-olds, and then many of the other sites have some overlap in terms of their prevalence numbers for both. And then one last graph for the overall data is that, and just to kind of explain how this graph works, so we collect information for 4 and 8-year-olds at the time when they were 4 or 8, but then we also look for any information we have from their early years. So we can track like how early did they actually get evaluated, how early did they get a diagnosis, and all of that. So what this graph shows is trying to compare if we map the child's age, so mapping the 8-year-olds and the 4-year-olds across their chronological age, at which point were they identified? Because we would imagine that for 4-year-olds, our efforts have changed, that we would improve our efforts for 4-year-olds so that they would be identified earlier than when the 8-year-olds were 4, for example. So in this graph, it just shows maps on both cohorts, and we can see how early were they being identified to see, are we improving for 4-year-olds and identifying them earlier? So overall, we do see some improvements. The line in yellow is the 4-year-olds. So we are identifying them slightly earlier. And then by 48 months, with just kind of a benchmark, 4 years of age, we have improved quite a bit in terms of identifying children with autism compared to when those 8-year-olds were 4 years old, for example. So this is a good way to kind of visualize across the child's life, when are they being identified, and are we actually moving the needle and identifying them earlier? So overall, when you look at all 16 sites and all of the data combined, we do see a general improvement in some of those early identification efforts. Okay. So now we're going to shift gears a little bit and talk about what does the data that we have from Texas show us? So one thing to highlight is that for the very first time, Texas is being represented in some of this ADDM data. In all the 25 years that ADDM has been in existence, Texas has never been a part of those, contributed to those numbers. So we're very excited to be one of the sites that is being captured in some of this autism data, and that we can learn more about our local community so that we can do more and help this community in ways that they need. So there are 2 sites. So our site, although we're at UT Austin, we're working primarily in Bexar County. And then another site in Texas is the city of Laredo, and they're working in Webb County area and that southern border area. So moving forward, all of the data that I'm going to be showing you is reflective of Bexar County and does not include information about Laredo. And we can share more information about if you're interested, but just for the sake of time, as well as for clarity, just keep that in mind as I go through some of our data. So it helps to know kind of like what is our population? What are some of those characteristics, right? When we're defining that population, what does this population look like? So this is basically the racial, ethnic, demographic area or characteristics of 4-year-olds and 8-year-olds and who lived in Bexar County for our surveillance. So as you can see, our population definitely reflected a majority Hispanic or Latino population. And so when you think about these numbers, like this is who those numbers represent. Okay. So when we look at prevalence, we do see that, and I'll present it for both years. So for our 4-year-olds, we do see that our prevalence is about 1 in 60 or 1.7%. in terms of 4-year-old children being identified with autism. And the graphic kind of shows us where we reside in the scope of all of the other sites, as well as the average. So I think the overall was about 2.9%. So we're definitely below the overall percentage or prevalence number for all sites, and we were kind of on the lower end of the scale in terms of identifying 4-year-old children. When it comes to our 8-year-olds, our prevalence numbers suggest it's 1 in 51 or 2%. And then once again in the graph, it shows us where we reside in comparison to other sites. So we were definitely below the overall rates reported, and then and just in comparison to where we are. So here we do see TXL is Texas Laredo site. So they did have the lowest prevalence of 8-year-olds across all 16 sites, and then California had the highest for both. So it does seem that we, at least in Texas, at least in Bexar County, and in 2022, our efforts to identify children with autism, there's room for us to grow and improve. So another important aspect of this data is understanding how early are children being identified. We know that early diagnosis can really open doors for a lot of families in terms of accessing services, and also just having clarity about what are the challenges that the child is having. So for our cohort of 8-year-olds, we did find that the median age of diagnosis was 42 months. So when you look at all the 8-year-olds that were identified with autism, the middle age was 42 months. So about half of the children were identified after 42 months, and the other half was like below 42 months. So it does give us a sense in terms of on average, or like what is the rate of when children are being identified. And in this regard, we are doing a little bit better than the overall rates. So when you look at the overall numbers for all the sites, it was the median age was 47 months. So we are doing a little bit better. So this would be about 3.5 years of age when most children in our catchment area are being identified or diagnosed with autism. Okay. One of the other aspects we look at is intellectual disability. So when we look at intellectual disability, something to note is that not all children will have information available to determine this. So this is all data from our catchment area. So this is also, let me see. So just to walk through the numbers, because there's a lot of numbers on here. Of our entire sample of children, we were looking at about 64% had data available. So it's not all of our kids, only about 64% had data. And then of those 64% that did have data available, 70% of them had intellectual disability. So this suggests that of the children who are receiving, for example, IQ tests or cognitive tests, either most of these children are receiving these tests because there's a suspicion of intellectual disability, or it can also suggest that our efforts to identify children with autism are leaning more towards children who may have higher support needs. And we may be missing or not referring children who may have lower support needs. And this is a lot higher, this rate at least is a lot higher than what we see for the overall group, which of the sample that had IQ data, about 40% had intellectual disability. So this suggests that we may need to improve our efforts to identify children who may not have intellectual disability, but may have some moderate or lower support needs. Okay. We can also look at sex differences. We know that generally in the field, we see that autism diagnoses have leaned more towards boys or males. And there are a lot more efforts in place to improve identification of females with autism. So how are we doing? So this is actually probably one area where we're doing a little bit better. So among our 4-year-olds, boys were 2 times as likely as girls to be identified with autism. So a ratio of 2 to 1, which we know for the longest time, the ratio has been about 4 to 1. And even when you look at the ratio for 4-year-olds overall, it was 2.8. And in fact, we had the lowest males to female ratio of all of the sites that were included in the ADDM network. So that is something that I think we're, at least with our 4-year-olds, we are doing a lot better in terms of identifying girls with autism. And then when we look at our 8-year-olds, we're also doing a little bit better. Our ratio was 3 to 1. So boys were 3 times as likely to be identified with autism as girls. And this is also lower than the overall rate of 3.4 among 8-year-olds in the overall sites. Okay. So in kind of in comparison to the last graph I showed for the overall data, this is our specific graph for our data, showing both like the mapping the 4-year-olds and 8-year-olds across their chronological age of the child, and to see how well are we identifying, are we improving in our early identification of children with autism. So as you can see, the purple and the blue line are kind of overlapping. So this means that our 4-year-olds are being identified kind of in a similar at similar ages as the 8-year-olds were identified, which suggests that we haven't really improved those efforts or made enough of a significant impact on moving that early identification even earlier than what we were doing like 9 years ago, for example, or 8 years ago. So there's definitely a lot of room for improvement here in terms of that early identification and ensuring that we can get better at identifying children at earlier ages. Okay, so I will pass it back to Adra, who will share more about how we can use all of this data in terms of supporting our public health outreach.
Hello, everyone. First, we are going to discuss how ADDM resources can be used by professionals. Here in this image on the far left, we have the milestone moments. This is a booklet, and CDC has produced this, and it is a free resource that can be utilized. Within this booklet, parents or caregivers can track their child's developmental milestones, and they can keep a written documentation. And within the booklet, the developmental milestones have a description, and then there are also visuals. We have a specific example here of what most children do by age 5. So this is implying like what developmental milestones are children typically reaching by age 5. Over to the right, it says help your child grow and thrive. This is for the Developmental Tracker app. The CDC produced an app where caregivers or parents can track their child's developmental milestones, and within the app, there are videos, I believe, of these milestones. So there's more of a visual example and representation. And of course, with the app, it's easier to keep it on the go instead of having a physical pen and paper. With your phone, people typically have their phone with them at all times. And on the far right, there are 2 books here, Where is Bear and Amazing Me. These books are utilized to promote early literacy in children. They are actually written for specific age groups as well. The Amazing Me is written, I believe, for 2-year-olds, and Where is Bear for 3-year-olds. Next slide, please. How can ADDM data be used to inform practices? We can plan for resource and service needs. Given the prevalence of autism in a specific region, what are the potential disparities of how people are accessing these resources? What are the resource needs in the specific community? Is increased access needed to support these families and individuals? How do we achieve this? And then, with once we answer these questions, we're able to target outreach to these specific communities so that we can ensure that we are increasing their access to the necessary services. Next slide, please. All right, and then how can ADDM data be used to inform policies? There is development of responsive policies to community needs, and these policies promote or support early identification, promote early childhood services such as therapies. And these policies can help identify how easy or difficult it is for families and caregivers to access these resources. And also, then we can identify what barriers can be reduced to increase the access. And that then leads to improved community infrastructure and systems of care. Next slide, please. All right, we will discuss what Texas ADDM resources are currently available. Here we have our Texas resource map. This is a free interactive map that contains and displays screening and evaluation services for autism in the entire state of Texas. This is a resource that our team created specifically, so I'll just preface with that. And within this map, all resources that we have been able to identify for screening and evaluation purposes specific to autism and includes services for adults and children, so the entire across the lifespan. Users who utilize this map are available to filter it by geographical region in Texas. As you can see, each little region has their own icon and color. It is divided by East Texas, West Texas, South Texas, Central Texas, Texas Gulf Coast, and North Texas. And then you can see a little black icon with a book. Those are for the education service centers in the entire state of Texas. So that has its own filter. Users can, it'll display each organization's name and then who they provide. So like what age group and what services they provide, what type of screening or evaluation services or even therapies. And then we also include insurance information. Is Medicaid accepted or private insurance is accepted, or is it cash pay only? That is all specified for each organization. And we also have a link to each organization's website and then their address. And because this is a Google My Maps, individuals can click on the address that is associated with this organization and it'll map them directly to it. This map can be used on the Google Maps app as well as a web browser. So it makes navigating to these organizations pretty stress-free, I would believe. And then if you provide autism screening or evaluation services and you don't see yourself on this list, please let us know. We'll be more than happy to add you so that your business organization is included.
So we have additional programs available for families. So we have a completely free developmental screening program available through our Texas ADDM website. Families can scan the QR code or follow the short link. It'll ask them to create a profile, ask them a couple questions, and then our team receives the information that they submit. We'll review it and identify local resources for the family and share the results back with them. So they'll get the actual report from their developmental screening outcomes, as well as some activities to support their child's development that are tailored to the child's age, as well as some next steps. And we currently have this resource available in English and Spanish. And then we can also follow up with families every 6 months to kind of see how the child's development is progressing over time. And it's completely free. Families can then share this information with their provider or educators if they feel it would help them better support their child. And then some other things. So we have a new study to basically provide this. The study is intended to help us learn more about that early diagnostic process and improve early identification and diagnosis of Latino children. So we're conducting comprehensive evaluations. They're free autism evaluations for families. At least one of the parents has to be Latino and live with a child. And we're collecting, this is the study in collaboration with Baylor University. We'll provide families the evaluation results as well as additional resources to help support their child's development. It's completely free for families, and families can earn gift cards for participating in this study. So if you know of families that would like an autism evaluation and they're between 1 and 3 years of age, they might be eligible. So please share with them. And then one other thing that we're doing, we're very excited. We're hosting our second annual Supporting Every Step Developmental Screening and Resource Fair. This year, it will take place on Saturday, October 18th from 9 a.m. to 2 p.m. And we will be providing free screenings to families, including developmental screening, autism screening, gross motor screening, vision and hearing screenings. So families can sign up for an appointment time, and they'll come and we'll do the screening with them. We'll give them a report the same day, as well as get them connected to resources at our resource fair. So families can still register. We still have spots available for screenings throughout the day. And they can just scan the QR code and sign up. And this will be taking place at the Commons Conference Center at the J.J. Pickle Research Campus. So it's right next to our center. And it'll be a lot of fun games and prizes. So please share with your families or please come. It'll be a fun day. So I think that concludes our presentation. I think there's a couple of questions we probably will need to get to, but I've also included here our email addresses if you have other questions or just want to share anything with us. So thank you so much for having us. We're really excited to share this data with you all, and I guess we look forward to your questions. Thanks. Let's see.
Yeah, we have some questions in the Q&A.
Okay. Okay, so Yadira asks, by any chance, was it also asked the amount of children referred to ECI as an early age due to their behaviors or development during this critical age? Unfortunately, we don't have a lot of information in terms of like decision points of like why a child was referred. We do collect more information in terms of like whether or not like a decision like was made about a diagnosis or things like that. And usually we don't collect that information in terms of why they were referred. But that is a good, that is something I think that would be interesting to look at to see like what are the reasons for referrals, right? And that can also be for ECI, it can also be a parent referral as well. So it's not clear, like, those are other things I guess we can look into potentially with other studies to see how that happens, right? In terms of that ensuring the early intervention services. Okay, next question. So an anonymous person says, when it says a lower amount of children were identified and was stated to have room to grow in identifying, how is that determined? It sounds like it is saying we didn't have enough identified to meet what we thought we need, so we need to find more. I think the idea is that we, when we look at these prevalence numbers, we consider there isn't like a known number, right? Of like, we know we need to get this number of children with autism. But when we do see very low numbers though, or percentages, it there's a lot of reasons why that may be. And that is just one interpretation of some of those lower numbers, is that we might be missing some kids. And there might be some children who don't get that identification, or maybe, for example, might receive services for speech versus autism, because their difficulties in the classroom lie more with communication versus autism specific things. So it just suggests that that could be something that's happening, where we're not identifying everybody that needs to be identified in those areas. But it could be that there's just less numbers, but it's hard to tell because we don't know what we don't know, right? But it's just one interpretation of some of those values. Someone else asked about efforts undertaken in Texas to improve male to female representation in autism diagnosis. Um, I'm not sure what these are. I'm expecting that some of these are due to some efforts. I'm not familiar with specific efforts in Texas to do this. I know generally as a field, there's been a lot more recognition about how autism might look different in females. And I think generally as providers, many colleagues that I work with have recognized that, and I think have been adjusting some of their approaches to diagnosis to kind of think more broadly about how autism might look like in females when it doesn't have that like like the classic or a typical presentation that we would see in males. But I would love to hear from others if you know of specific efforts that have been underway in Texas. But it is something that I think was interesting to see, and kind of, we weren't last, so that's always good. Okay, let's see what else. IQ tests have shown indication of racial bias as an instrument. There seems to be a gender bias for autism testing. Has there been any research to indicate racial bias in autism testing? There's been some work done in terms of some of our diagnostic tools, and some of this work we've done ourselves. And I think we have kind of looked at, especially with language, in terms of evaluating families from who may not speak English, for example, as their primary language. So I think there is a lot of research out there. It kind of just depends on the nature of like the specific screening tool, the specific questions that are being asked, as well as clinical judgment, because that does factor in a lot in terms of the final decision that gets made, right? So a lot of these tools is just one piece of the broader scope of that clinical assessment to determine whether or not a person meets criteria or qualifies for an autism identification. So yes. So for the ideal study that I mentioned, where the free autism evaluation, we will be doing the ADOS as part of our standardized measures. So yeah. Okay. Let's see. Guillermina mentions, I believe we need more resources in South Texas for autism. Yes, definitely. I know we have a couple of partners that we work with in South Texas, and we have some colleagues who are also in South Texas doing a lot, but I think there's a lot more work to be done. So hopefully we can help continue collaborating and building up these systems so that we can provide more resources and better resources for families, for especially for those areas where there's very limited resources or very limited services available. Okay. Will the 2 Texas sites be Adams sites for the next study period? Good question. We don't know. Usually the CDC has a call for applications every 4 years. So we're currently entering at the end of our time in the network. So we shall see what happens. A lot of this depends on federal funding for the CDC and for autism surveillance efforts. So hopefully there will be continued funding for our work, and we would definitely want to continue doing this work so we can continue to learn more about our communities in Texas. Okay. Oh, yeah, you'll have a lot of great questions. Are there any plans to expand the age range for autism diagnosis tracking to include older children and adults in the ADDM network? Good question. So there are some sites that do track 16-year-olds. Because we were a new site, we just focus on 4 and 8-year-olds, but there are several sites that do track 16-year-olds. And there should be some information on the CDC ADDM website that can where you can see some of the results from those efforts. And that is something that has been newer in the more recent years. But I believe they've published a few papers now looking at the 16-year-olds. So far, as far as I know, I don't know if they're going to expand to adults. There are other national surveillance or survey studies that do include adults with disabilities more broadly. So that is another way to we can see how adults are faring in terms of access to services and health outcomes and things like that. So yeah. Okay. Will we receive a transcript in the slides of this presentation? Good question. I think that's a question for Caroline. I will let her.
Will you be wanting to share the slides of the presentation?
Yeah, I mean, we can share a PDF of the slides.
Yeah. Okay, because I know
I
that
don't
was
know about the
another
transcript though,
question.
but
Yeah, transcript, I will definitely try. And I believe that is possible.
okay. All right. Okay. Angela says, as a parent of an autistic child who was diagnosed early and received therapy and support from the start, I appreciate what you are all doing to make the information more accessible to those who need it. How can we get medical healthcare providers who may not be actively participating in autism education this information to better serve their communities? That's a very good question. There's I mean, these are all things that you can also share with them in terms of there's a community report that the CDC developed that makes information short, quick, and brief. So, these could be some things you can share with your provider at your next visit. We're trying to do some projects where we provide more education and consultation support to providers to kind of help identify some of those challenges and kind of streamline the process to improve some of that early identification. But it is kind of like a professional level type of effort in terms of not only improving current providers, but also improving access to that information for trainees, right? So that's one of the things we do with our LEND program is we try to provide that really comprehensive training and education on neurodevelopmental disabilities. And to students who are training to be in the field, and hopefully and with the idea that they will take that on and then become leaders in the field and pass on that information to others in their fields. But it is a continuous challenge, right? Because we want to make sure that all providers have information to better serve the autistic community. Okay. The Alexis asked about sharing the pre-screeners. Let's see if I could share again. And I believe so there's a few of them. So there's this one, the developmental screening program. So this one is for children from 0 to 5. And then we can also put links, I think, to these in the chat. Or you could also email me and I'm happy to send all these flyers. We have all of these in flyer form as well. And then this one is the autism one, autism evaluation. And this is for children between 1 and 3 years of age. And they just have to live in northern central Texas. And then I'm the main contact for this project. So you feel free to email me. And then this is our screening event. So the link, the QR code here is to register for the screening. You can also email me if you just want more information or the flyers to share with others. But yeah. Okay. And then Robert Mersinger, great presentation information. Thank you for what you're doing to raise awareness and provide resources. Great. Thanks for coming. Federico asks, has your organization considered language and deficit model thinking about the autistic experience? Here's a resource that I implore everyone embraces. As a neurodivergent scholar and lived experiences, I think it's important to advocate for neurodivergent individuals. Great. Thank you so much for sharing this resource. We'll definitely take a look at it. And that is something that we are being more intentional about, being more inclusive and really centering that lived experience in the work that we're doing. So thank you for sharing this resource. Okay. So what kind of comorbid condition prevalence tracking is ADDM doing? So within ADDM, so for the latest data, they did share there's a MMWR, which is kind of like the more technical report of our findings. And there is some information in there about like other classifications that the children have been identified in the school system. So for example, if they're receiving services not only for autism, but also speech language impairment or other health impairment or vision and hearing, things like that. So that may be a good resource to kind of look at. And that document is on their website. I think in terms of more broadly other types of co-occurring conditions, I don't think we do collect some of that information about other diagnoses, but I don't think we've done like a extensive analysis of that data to have a clear idea of what percentage of children with autism also have other conditions. But it's a very good question. So I'll bring it up and kind of see what if there's things that like we can put together to kind of share more about what that looks like. Thanks for the question. And then someone's asking for the evaluation survey link. I'm not sure if that has been shared in the chat. So let me stop.
Hi, so yes, once the webinar ends and we close out, you will automatically be redirected to the evaluation survey.
Okay.
Are there any other questions?
Well, great. I hope this was helpful or informative, and please, share the resources we shared with you all with others in your community. Let them know that we're providing all these resources and supports. And if you have any thoughts, feel free to email me. We're always happy to learn more from the community and yeah, and just help improve things for everybody. So thanks so much.
Yes, thank you, everybody. We dropped a lot of links in the chat. Feel free to use those or email us if you need those resent. And before we close out, I know Dr. Vanegas touched on a lot of our upcoming events. Oh, I do see there is a raised hand from Benny. Is that intentional, Benny? Do you have a question to ask us? Yeah, so Dr. Vanegas touched on our screening fair that is on the 18th. We dropped a flyer there in the chat. For anyone who is interested as well, another one of our programs here at TCDS, E4 Texas, is hosting their open house on UT's campus. And E4 Texas is a post-secondary training program. Additionally, our next Autism Consortium webinar will be on Friday, October 17th, at the same time. And we look forward to seeing you there, and we'll send out more information soon. Thank you all for attending. Oh, raised hand was an error. Thank you, Benny. Thanks, Alexis, for joining. You're welcome to sign off now.